Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Brittany Bonds with Helping Hands.
Yes.
Welcome, Brittany.
Well, thank you so much, Paige. I'm excited to be here.
Brittany, you're new to this role with Helping Hands. Tell us a little bit about your first few months with Helping Hands. How you got there, who you are, a little bit of that.
Okay, well, I joined Helping Hands at the beginning of October of 2022. I'm the new executive director who has taken over the organization. I am incredibly excited to be there. I've worked in nonprofit healthcare for about 14 years, so Helping Hands was just a blessing and an opportunity to be able to continue to give back to this community. I'm a lifelong Caldwellian, so I'm happy to be able to support an organization and to contribute to an organization that does so much for folks in our community.
For people who don't know, give us an overview of Helping Hands.
Yes. So Helping Hands Clinic is the only free clinic in Caldwell County for low-income uninsured adults. And our mission is to help improve the health of our patients who want to engage in their care. And we do this by providing primary care and urgent care on site. We have providers on site. We're a medical clinic, just like any other doctor's office. We also support our patients with chronic illness management. We have a licensed pharmacy on site that provides any life-saving medications that our patients need. And we are able to do all these services for free or at incredibly low cost. More recently, we have included a dental health program in partnership with the Caldwell County Health Department, which serves uninsured adults. We focus on extractions and keeping people out of pain and away from infection are really the goals for that program right now. We also have recently initiated a mental health program. So we have a licensed counselor on site at least one day a week. This is a partnership with Breathe Wellness Counseling out of Granite Falls, and this provider provides free counseling visits to our patients to support their needs and works with our providers to make sure that our patients, not just their physical well-being, but their mental well-being is being addressed and taken care of as well.
A lot of awesome services. Tell me about the patients you serve as far as what's the criteria?
So in order to be eligible for Helping Hands services, our patients have to be uninsured and not have access to Medicaid, Medicare, or any other government assistance that supports their health care. They have to be at or below 250% of the federal poverty level, which is about $51,000 for a family of four. And then we just have to bring those patients on board. We enroll them into our services just like you would enroll at any other doctor's office, and we're able to provide that care. Now, sometimes our patients graduate and they either get a new job where they have access to insurance, or they become eligible for Medicare or Medicaid, and we help transition that patient to a more appropriate provider at that point. We also have a really wonderful program called CHAP. It's the Caldwell Health Access Program, where we have a partnership with many of the physicians and physicians' offices in Caldwell County, so that if a patient, let's say someone comes to us who has lost their job, they have a primary care physician that they have seen for years and years and years, and they really don't want to end that relationship with their physician. We can work with that physician in order for that person to be a Helping Hands patient, have access to all of our other ancillary services and care navigation that we can provide, and they can continue seeing their primary provider, which I think is wonderful. That was one of the things that I was really excited about when I joined Helping Hands, to learn about how that process works and just the generosity and support of our local health system. Mm-hmm.
A lot of ways to help uninsured people in Caldwell County. And when we say uninsured, we're talking primarily adults here, is that correct?
Yes, our clinic serves low-income uninsured adults because we don't want to create duplication of services. And if you need, health care for your children, that can be accessed at the health department. Women's services, those kinds of things can be accessed at the health department. So we work in collaboration with a lot of our community partners to make sure that we're meeting needs that are unmet in other places.
A few minutes ago, you mentioned that you have a pharmacy and you provide life-saving medications.
Yes.
When you say life-saving medications, what does that mean?
Well, primarily, when I think life-saving medications, we're talking about patients who need blood pressure medication, insulin, inhalers for asthma, those kinds of things. We have great partnerships through patient assistance programs with the many of the national drug companies, where we help our patients access those medications, and they're sent to our pharmacy. We also have a partnership with Caldwell UNC Healthcare, where we're able to receive some generic medications that patients need from a budget with the community pharmacy there as well. So, but in all, on average, we usually dispense. Last year, I think we dispensed 13,000 medications for our patients, and we usually, I think, an average of about $4 million worth of medication, flows from our pharmacy every year. And these are prescriptions that our patients might not be able to afford or have access to otherwise. So.
Your patients, approximately how many patients do you see in a year?
Yeah. Well, last year we served about 1,200 patients. We have seen a slight decrease in patients served over the last couple of years during the pandemic, when no one's accessing health care. And, I feel like we're finally sort of moving out of that fear around coming to the doctor's office. And so we're seeing an increase in enrollment, which is really exciting, because we know that the need hasn't changed in the community. And we have around 8,000 uninsured residents in our county. And so being able to provide this service for them, and knowing, if you've changed jobs, you can't afford your insurance, if you don't have access to insurance, and you're not eligible for Medicaid, please reach out to us, because we can help you and we can be your medical home.
So how do people reach out to you?
So the best way is to call Helping Hands, and we can put the number.
Yes, we can put the number on the screen, and probably even your website.
That would be fantastic, because I don't know that I could speak our number out loud. I'm still learning. But patients can call us, and we have an enrollment process. So one of our team members will get back with them. We do, because of the patient assistance programs and the pharmacy process, we have several pieces of documentation that we need to ensure eligibility, and then we're able to get our patients scheduled, get them in to see that doctor, get them taken care of. And another thing I forgot to mention earlier was that all of the patients that are served by Helping Hands are duly enrolled into UNC's charity care process. We have an agreement with UNC Healthcare that just basically any patient who is enrolled in our services is eligible for charity care. So that way, any of the specialty services or labs that we can't offer on site, we have that partnership so that it's provided for those patients at an incredibly low cost.
To make all of these wonderful things happen, you rely on volunteers.
Yes.
Talk to me about your volunteers.
We have a fabulous group of volunteers who support the work at Helping Hands. Primarily, you will see volunteers at Helping Hands in the pharmacy. So if you come to the pharmacy to have a prescription filled, it's most likely going to be a volunteer who's at the window, who gets your prescription and checks you out and does everything that you need. Our volunteers also support us with administrative tasks, with some of the back-end work. We have a very small staff, and that's done with a purpose, because we want as many of the dollars that come into the clinic, which is completely privately funded, to go back into patient care. And so our volunteers really help us make that happen. We have wonderful support from the Lenore Service League, who come and volunteer at our pharmacy every month, and they are wonderful. And we are incredibly blessed by the group of volunteers who support us, definitely.
To become a volunteer, do they just need to call your office?
Yes, you can just call our office. Deborah Filial is our assistant director, and Deborah's the primary contact for folks who are interested in volunteering. And it's a really simple process to sign up. We just need you to sign a confidentiality statement, because we are a medical clinic, but there is lots of wonderful work to do. And we would definitely be happy for someone who has a heart for our mission to come and be a part of it.
Okay, you mentioned you're completely privately funded.
Mm-hmm.
And you hold, I believe, I may be wrong, one major fundraising event a year?
We do, yes.
And it's coming up.
It is coming up.
Coming up really soon.
Yes.
So tell us about Pot of Gold?
Okay, so the Pot of Gold is the signature fundraising event for Helping Hands Clinic and has been for the last 17 years. And we are incredibly excited because the 2020 Pot of Gold was set up, decorated, ready to roll, and about an hour before the beginning of the event, we received the call. It was the day of the shutdown. So the Helping Hands team at that time had to undecorate and not get to have that wonderful party. And since then, we haven't been able to have the event in person because of, COVID, and we're all trying to be safe, and we don't want anyone to come and get sick. But this year, we're able to get back in person. We're incredibly excited. It's going to be on Friday, March 17th at the Broy Hill Civic Center, and we're going to go from 6 to 8 p.m., great food, great music, good fun, and then the big draw for the event is the $5,000 raffle grand prize. So we'll draw for the raffle winner at that time. But right now, tickets are available. Raffle tickets are available to anyone in the community. You're welcome. Anyone in the community can check our website. You can purchase either event tickets or raffle tickets there. And of course, if any of our community businesses or organizations would be interested in sponsorships, we're accepting sponsorships as well.
So. An evening of fun.
Yes.
Chance to win $5,000.
And other great prizes.
And food.
And food, yes.
What more could you want for celebrating
exactly.
St. Patrick's Day?
I mean, I don't know what else you would want to do. And then we'll wrap up around 8 o'clock. So if you want to continue your St. Patrick's Day celebration, you have time to do so. And you will have had a great time with us as well. And it supports a really great cause because all of the funds that come from Helping Hands go directly into our patient care. It's an incredibly important part of our annual operation. So we are really excited to be back on board and doing this in person again this year.
And one other note, you don't have to attend the event to be part of the raffle.
You do not.
Just buy raffle tickets.
You can just buy raffle tickets, and you will receive a phone call as soon as your card is drawn if you are the winner. So.
So lots of ways to get involved with Helping Hands.
Yes.
Brittany, is there anything else I know there's a lot of things about Helping Hands, but being your first show, anything else you want to talk about for the overview that we're doing today?
I would just like to say thank you to our community for the support that Helping Hands receives. I've been with the organization for a few months, and every day I am overwhelmed and incredibly grateful for the way that our community, stands up for this organization and for the support that it receives. And I've had the opportunity to sit down with some of our patients just in my learning and, to kind of get a feel for not just, I know what our services are and I know the things that we do, but how does this impact our patients' lives? And I got to sit down with this wonderful gentleman named Andrew, who shared his experience with Helping Hands with me. And he was a long-haul truck driver and had, I think he had been on the road for about 45 years with that job, and had a massive heart attack and discovered that he had, very uncontrolled diabetes. And because of those two things, he was no longer able to drive a truck. And so for the first time in his adult life, he was unemployed and he was uninsured. And so when he left the hospital, they connected him with Helping Hands, which was, in his words, a great blessing to him. He has been a patient of ours for a little over a year and a half, and in that time he has lost 50 pounds. His blood sugar has been maintained and controlled, and so for anyone who understands, his A1C went from 10.7, which is very uncontrolled, to a 5.7, which is a pretty amazing transformation. And he now walks a couple miles every day. And he attributes that success to the support that he got from his doctor at Helping Hands, from the support that he got from the diabetic educator that we were able to connect him with on site at Helping Hands, and from the support of our team that was a huge part of his health journey. And so Andrew's story is what really hooked me on our mission. And I am so grateful to be able to help him and then the other 1,200 patients that we serve, within a year, meet these same kinds of goals and improve their health. So this is something I'm grateful for.
I'm going to ask this question again because I think volunteering and serving our nonprofits in our community is very important. So I'm just going to throw this out there. We've talked about volunteering. We've talked about the pot of gold. How else can people help you?
The other way that folks could support our work is to help us connect with people who need our care. If you have friends, family, if you yourself are uninsured and you need the support of a medical home and the care of a doctor, please reach out to us. We can help you. If we're not the right fit for you, we can help you find the fit that works for you. We actually can provide pharmacy services, is something I didn't mention earlier, for patients who are not enrolled in our clinic. So, if someone is uninsured and isn't necessarily a patient of ours, but they need support with their medications, we can help with that. And I would also encourage our community, if you have a heart for the mission that we serve, to please give to our organization, because we are completely privately funded. We are able to provide these services to our patients for free, so they don't have to choose between, do I buy my insulin this month, or do I buy healthy groceries, or do I, pay my power bill? I mean, because some of our patients, that's the circumstances that they're facing, and so that is the gift that we're giving to the people in the community who we serve, and that is the gift that our wonderful donors are giving to the community that we serve. So,
Brittany, thank you for being here. Thank you for taking on the new role as Executive Director at Helping Hands. I know you've got your hands full, but you're reaching a lot of people with a lot of good work. So thank you for that.
Well, thank you so much, and thank you for having me. I'm happy to be here and to talk about the work that we do.
And thank you for watching Caldwell County Today.